If you've got vertigo, this thing may be able to fix it. According to the National Institutes of Health, approximately 15 to 20% of adults experience dizziness or vertigo on an annual basis. An even more shocking statistic is that a condition that you've probably never even heard of called benign paroxysmal positional vertigo, otherwise known as BPPV, is 10 times more likely to be the culprit of this than Meniere's disease, which is the condition that everybody thinks of. Now, if you're already familiar with BPPV, then feel free to skip forward a few minutes in this video where I start getting into the review of the DizzyFIX. But if you've never heard of it before, stick with me for just a few minutes because it could clear up what's making you dizzy. BPPV is a type of vertigo that is caused by head movement and will typically give you vertigo for anywhere between 20 to 30 seconds, and then that vertigo subsides. A lot of people with this condition will experience this dizziness first thing in the morning when they get out of bed because they go from a laying down position to a sitting up position. And oftentimes they'll have to sit there for 20 to 30 seconds, wait for that vertigo and dizziness to go away, and then they can get up and start moving around. This condition has a lot to do with your inner ear because when you think about balance and dizziness, there are three main components of it. You have your inner ear vestibular organs, you also have your eyes and your proprioception, which is your physical contact with your surroundings. Oftentimes you hear me speak of the cochlea, which is the hearing portion of your inner ear located right here. However, connected to your cochlea is the vestibular portion of your inner ear, which is comprised of the saccule, utricle, and three semicircular canals, including the anterior, lateral, and posterior. BPPV occurs when calcium carbonate crystals called otoconia break free from the utricle and start freely floating around one of the three semicircular canals. Approximately 80 to 90% of BPPV originates when these crystals get into the posterior semicircular canal. A very small percentage of BPPV originates when these crystals get into the lateral or anterior semicircular canals. When head movement occurs, these crystals that are floating around in the improper semicircular canal create additional movement, which triggers a signal to your brain that is mismatched from the other ear that's typically working fine. When your brain receives different signals from each ear, it creates dizziness. So what causes these calcium carbonate crystals to dislodge from the utricle and start floating in places that they shouldn't be? Oftentimes this is caused by age, physical trauma like getting in a car accident, or inflammation inside of your inner ear. Diagnosis of BPPV is often done by performing a Dix-Hallpike procedure, often administered by a vestibular audiologist or a physical therapist. This is where they will turn your head either to the right or to the left, and they will lean you back where your head will fall off the edge of a table, and they will start looking at your eye movements. What they're looking for is different eye movements created by BPPV when you're put into this position. If your eyes start beating in an upward direction and a counterclockwise or clockwise torsional movement, it often indicates that you have a posterior semicircular canal, BPPV. If your eyes start beating in a lateral direction or downward direction, it often indicates that you do not have posterior BPPV and you may have one of the other forms of BPPV. How many times do you think I'm going to say BPPV in this video? Because it's starting to get hard to say. Okay, so after they diagnose you with posterior semicircular canal BPPV, they will start doing Canalith repositioning procedures like the Epley maneuver or the Gans repositioning maneuver. There are other forms of maneuvers, but these two are by far the most popular. Alright guys, hopefully you're enjoying this video so far and learning a little bit along the way. If you are, make sure that you hit that like button. It really helps out the channel. And if you want to see more videos just like this one, make sure that you hit that subscribe button with notification bell because I publish a bunch of new videos every single week. That being said, really appreciate it. Now back to the video. The basic concept of Canalith repositioning movements is to take these otoconia crystals and start guiding them through your semicircular canals back into the utricle so they can stop causing you dizziness. Oftentimes, immediately following your diagnosis of BPPV, your vestibular audiologist or your physical therapist will actually take you through these Canalith repositioning procedures to try to guide these crystals back into the utricle. Oftentimes, they even advise you to do these different repositioning movements at home. However, performing these movements and performing them correctly are two entirely different things when you get home and you don't have anyone there to guide you. This is the problem that the DizzyFIX was designed to solve, which I will have linked down in the description if you want to check it out for yourself. DizzyFIX was created by an otolaryngologist, Dr. Matthew Bromwich, as a way to provide at-home assistance for Canalith repositioning exercises, and I have to say, this thing is pretty genius. Essentially, it provides visual feedback to ensure that you're actually performing these Canalith repositioning maneuvers correctly from the comfort of your own home, so you can actually get BPPV to go away. Now, this guy is comprised of a Velcro adjustable hat with a drawstring to help keep it snug on your head. It has a rod that extends out, I don't know, about 6 to 8 inches to this tube that has a little green ball that's floating around. That is what you're trying to guide along these tubes that have this fluid inside of it. Now, when you wear this thing, you want it to be snug on your head. So adjust the Velcro however you need to have it adjusted. Boy, that looks cool, doesn't it? And then you want to take this drawstring and tighten it up, because you do not want this thing flopping around when you're doing the movements, because that could mess things up. Now, depending on which ear you have the posterior semicircular canal BPPV in, that is the side that you want this green dot to be started in. And you know what? Let me just go and change it into something more comfortable and show you. We can lean back on our bolster here. Right now we have a foam roller. You could use a pillow or something like that as well. But we're basically going to lean straight back on it with your shoulders. And you might get dizzy with this. That's totally okay. And then you're going to turn your head over to the right, and you're going to watch that green particle fall through the tube. And this may take approximately 30 seconds for that particle to stop moving. But as you can see, he is working his way through the tube. And if you're having dizziness, that's okay. That dizziness should subside in around 20 to 30 seconds with BPPV. So you can see that particle is still moving there. So I'm going to hold this position until I stop seeing the movement. All right, so he's about stopped there. Once he's stopped, then we're ready to rotate our head all the way over to our other side, and you're going to continue to watch that particle fall. So I can see that he's falling down into the elbow there. You want to hold this position for about 30 seconds. And that green particle should stop moving within that time period. After 30 seconds has gone by, you're going to continue with the movement by rolling over on your shoulder and looking almost straight down and letting that particle fall even further. And I can see that that particle is continuing to move, so I'm going to hold this position until he has stopped completely. You may or may not be dizzy by this point in the movement. That is totally fine. And it's been about 30 seconds. Once it's been 30 seconds and that particle has stopped moving, we are going to sit up to complete the movement. Now, if you've done this movement correctly, that green bead will have moved from the right-hand side over to the left-hand side if you are treating right-sided BPPV. I am confirming that it is in that yellow side right there, which is good. And if you had to stop doing this movement at any point during that movement, then you have to start over from scratch. You can't, get up in the middle of it, go back down and continue the movement. It doesn't work that way. So you may have to do this multiple times as well, based on the recommendations of your vestibular audiologist or your ENT or your physical therapist. But this tool definitely provides a lot of assistance with doing this the right way, which is greatly appreciated. All right, that's it for the movement. Let's go ahead and get back up to the studio. Now you might be asking yourself, okay, I see how it works, but does it actually work to fix BPPV? Well, research suggests that the answer to that question is yes. Back in 2008, a randomized controlled trial of 50 volunteers identified that individuals who performed Canalith repositioning using the DizzyFIX performed the maneuvers significantly better than individuals who were just given traditional instructions on how to perform these maneuvers. We also know, based on research, that performing performing these repositioning maneuvers with the DizzyFIX are also just as effective for fixing BPPV as the traditional repositioning maneuvers when the traditional maneuvers are also done correctly, allowing DizzyFIX to gain FDA approval. I've just got to say that I would have loved to have had this thing in grad school when we were actually doing these repositioning techniques, because this would have given me a visual reinforcement to make sure that I was actually doing them correctly for my patients. In fact, they even have a professional version of this for professionals so they can make sure that they're actually doing these techniques correctly inside of their clinics. Now, I don't mean to come across as rude when I say this, but I have a very low level of confidence in patients being able to go home and perform these maneuvers correctly with just written instructions. I think that having a tool like the DizzyFIX would substantially increase the effectiveness of them doing these exercises at home. Now, as far as potential cons go, I can think of a few. One is your mobility. If you do not have good mobility and you cannot get down on the ground or on a table or on a bed and actually perform these movements, then you're going to have a professional work with you to do them. The second potential con is that you use the DizzyFIX incorrectly. The only way that you're going to get rid of BPPV is if you go through the proper movements and actually guide these otoconia crystals down back into the utricle. And if you don't use it the right way, it's not going to fix the problem. And the third potential con is that you don't actually have posterior canal BPPV. You may have a different form of BPPV, and if you think that the DizzyFIX is going to fix it, it's not going to fix it. I don't know if it'll make it worse, but you're still going to be dizzy. Aside from these three potential cons, I still feel like the DizzyFIX is a worthwhile tool, even if you only have to use it once. If it gets rid of your dizziness, it is worth the $55. At the end of the day, it sucks being dizzy, and if there's a tool that's out there like the DizzyFIX that can help you get rid of your dizziness by treating the root cause of that dizziness rather than just masking it over with different medications, then I'm all for it. So if you have been specifically diagnosed with posterior semicircular canal BPPV and you want some help performing these different head movements at home, then the DizzyFIX could be exactly what you're looking for.